You are alone in your kitchen. The house is quiet. You take one normal bite of food. Nothing unusual. But suddenly, the food stops halfway down your throat. You try to cough. No air moves. You try again. Still nothing. Your chest tightens. Your hands instinctively grab your neck and the terrifying realization hits you. No sound is coming out. You look around the room. No one is there. Your phone is across the counter. Your lungs are trying to pull in air, but the airway is completely blocked. Within seconds, your body starts to panic. Your heart races, your vision begins to narrow, and every second feels longer than the one before. In a situation like this, you may have only a few minutes before it becomes life-threatening. This is not rare. In the United States alone, more than 50,000 people die from choking every year. And a large portion of those deaths happen to adults over 60 who were alone at the moment it happened. No witnesses, no help, just a silent emergency unfolding in a kitchen, a dining room, or a living room. After 60, choking becomes more dangerous for reasons most people never think about. Swallowing muscles weaken. Saliva production changes. Certain medications can dry the throat and make swallowing more difficult. These small changes increase the risk more than most people realize. Most people believe choking is impossible to survive alone. They imagine the Heimlich maneuver requires another person. But that belief is not entirely true. There are techniques that can create the same pressure using your own body. Simple actions that can force air upward and push the obstruction out. Methods that, when done correctly, can make the difference between panic and survival. In this video, we will reveal 7 life-saving techniques every senior should know to survive choking alone, ranked from least powerful to most powerful. And number 3 is the method many people never hear about until it is too late. It can create enough pressure to clear the airway, even when no one else is there. For your safety, this content is provided for educational purposes only and should not replace professional medical advice. I have placed practical guidance notes in the description if you want to review them after watching. Before we dive in, here's a quick question. Are you watching this video alone right now? And how old are you? Tell me in the comments because I read through them myself and respond whenever I can. Now, let's begin with tip number 7. The first action that can buy you precious seconds when the airway suddenly closes. Number 7. Stop moving and force yourself to stay completely calm. This may sound counterintuitive because your body is desperately craving oxygen, but the very first thing you must do the moment you realize something is stuck in your airway is pause everything and resist the intense urge to panic. This is your first and most critical step, and it is not optional. Studies from emergency medical research have shown that people who panic, start rushing around, or move uncontrollably can actually cause the blockage to shift deeper into the airway in a significant number of cases. When your brain detects that oxygen levels are dropping, it rapidly releases stress hormones like adrenaline and cortisol. This triggers a powerful fight-or-flight response that causes your entire body to tense up. Unfortunately, this includes the muscles around your throat, which need to stay as relaxed as possible in this situation. Panic can also make you inhale suddenly and sharply without control. That quick gasp can pull the object further down into your airway, turning a partial blockage into a complete and much more dangerous obstruction. Instead, during those first critical seconds, you need to stop moving, clearly recognize what is happening, and consciously remind yourself that you know what to do next. Medical professionals often recommend creating a simple mental anchor phrase, something short and reassuring like, "I know what to do," or "stay in control." Practicing this phrase ahead of time helps your brain respond automatically under extreme stress. Think of it like how pilots train for emergencies. They repeatedly practice critical procedures so that when a real crisis happens, their training takes over instead of panic. The same mental conditioning can work for you in a moment like this. If you live alone, practicing this mental reset even occasionally, while sitting calmly at home, can help build a strong mental response pathway. When a real emergency happens, your brain will be more likely to follow that trained pattern instead of reacting with fear. The calmer you keep yourself, the more efficiently your body can use whatever air remains in your lungs. That control can give you valuable extra seconds to apply the physical techniques that come next. Staying calm is your starting point, but now you need to act quickly. Before we continue, take a moment to like this video and subscribe. The next steps could be extremely important for your safety. Number 6, grab your phone and dial emergency services immediately. The moment you have taken that mental pause to steady yourself, your very next action is to reach for your phone and call emergency services, even if you cannot speak at all. Many people skip this step because they believe calling for help requires talking on the phone. But that is not the case, and understanding this difference can save your life. If your smartphone is within arm's reach, dial your emergency number and leave the line open. Emergency dispatchers are trained to respond when they hear signs of distress such as choking, gasping, struggling, or even complete silence from an open line. Modern emergency systems now use enhanced location tracking that can identify your position through your phone signal with impressive accuracy. This means even if you cannot say your address, responders can still be guided directly to your location. If you wear a medical alert pendant or wristband, and ideally anyone living alone should consider having one, press the emergency button immediately. It takes only a second and connects you to a monitoring center that can send help to your registered address without you needing to speak. Health organizations strongly advise that individuals who live alone keep their phone within reach during meals. Not across the room, not charging on a counter, and not left in another area of the house, but right beside you while eating. Research into choking incidents has shown that in many cases involving individuals living alone, a working phone was present in the home but not close enough to be used when the emergency occurred. If you are in an apartment or shared building, making loud, repeated banging noises on a wall or floor can also attract attention. Neighbors are likely to respond to unusual and persistent sounds. The key idea here is simple. Calling for help and trying to save yourself are not separate actions. You need to do both at the same time. Activating that emergency call means help is already on the way while you continue with the next self-rescue steps. Now that help is in motion, you must immediately position your body correctly for the next technique. Number 5, stand up straight and lean your entire upper body forward. Once you have triggered some form of external alert, your next physical step is to move into a standing position if you are seated, then lean your upper body forward at about a 45-degree angle, allowing your head to point downward toward the floor. This positioning is not random advice. It is supported by basic principles of physics and an understanding of airway anatomy. When you remain seated upright, or worse, lean backward against a chair, gravity can work against you by allowing the obstruction to settle deeper into the airway. However, when you lean forward and lower your head, gravity begins to assist you by encouraging the object to move back toward the mouth instead of further down into the trachea. Clinical observations have shown that a forward-leaning posture can significantly improve the effectiveness of coughing and other clearing techniques, compared to remaining in a fully upright seated position. Medical specialists explain that changing the angle of your upper body alters how gravity interacts with the airway. In a forward position, the throat becomes more aligned in a way that supports the movement of the obstruction outward rather than trapping it deeper inside. If you are unable to stand due to mobility issues, pain, or balance concerns, move yourself to the edge of your chair and bend forward at the waist as much as you safely can. Let your head drop below chest level while holding onto a stable surface, such as a table, for support. This position also creates more space between your diaphragm and your throat, allowing your lungs to generate stronger bursts of air pressure. That extra force will be essential for the more powerful techniques coming next. Your body is now in the correct position. It is time to use your lungs with purpose. Number 4, cough as hard and as deliberately as you possibly can. Your body's natural defense against airway obstruction is the cough reflex. If you still have any airflow through your throat, even a faint wheeze or a thin squeak, your airway is not completely blocked. A deliberate, powerful cough is your most immediately available and effective tool against the obstruction. The key word here is deliberate. You are not hacking away randomly or hoping for luck. You are performing what pulmonologists call a staged diaphragmatic cough, drawing in the smallest possible breath through the narrow remaining opening. Hold that tiny volume of air for about half a second to build pressure behind the blockage, then expel it outward with the maximum force you can generate from your diaphragm, not from your upper chest or throat. Medical research has measured the airflow produced during different coughing techniques, and the results are impressive. A properly executed deep diaphragmatic cough can produce airflow speeds of nearly 500 miles per hour at the obstruction, powerful enough to dislodge most common food items that cause choking in seniors. The critical mistake many make in the moment is coughing weakly and rapidly from the upper chest, using shallow bursts that barely move the obstruction and waste precious air. Instead, treat each cough as a focused, explosive event. Plant your feet firmly, tighten your abdominal muscles, and blast the air from your lungs with every ounce of force. Perform these coughs in disciplined cycles of 3 maximum effort blasts. Pause for a full second, inhale any new air you can, and repeat the cycle. The forward-leaning position from the previous step makes these coughs even more effective, as gravity helps push the obstruction upward and out toward your mouth. Coughing is your first physical weapon. But next, we are going to bring in a piece of furniture to amplify your efforts. Number 3. Drive your abdomen hard against a chair back repeatedly. If several full cycles of strong, deliberate coughing have not cleared the obstruction, it's time to escalate to using a solid external object to perform self-administered abdominal thrusts. The most readily available and effective tool for this is the sturdy back of a standard kitchen or dining chair, something you almost certainly have within a few steps of where you eat. Grab the chair and position the top curved edge so it presses firmly into your upper abdomen, in the soft area just above your belly button and below the bottom of your rib cage. Hold both sides of the chair tightly for maximum control, then drive your entire upper body forward and downward against the chair back with a sharp, aggressive thrust. What you are doing here is essentially replicating the traditional Heimlich maneuver on yourself, using the chair edge to create the rapid, powerful upward pressure on your diaphragm that another person would normally provide if performing the standard rescue technique. This chairback self-rescue technique is officially recommended by the American Red Cross for people who are choking alone. Their research and training data show that, when performed with correct positioning and sufficient force, it is highly effective and has success rates comparable to the traditional two-person Heimlich maneuver. Your thrusts must be sharp and forceful. A gentle lean is not enough. Think of it as folding your upper body over the chair back with a quick, powerful push each time. You may need to perform 5 or 6 thrusts, or more, in rapid succession. Each thrust should be distinct and deliberate. Avoid slow rocking or grinding motions. A medical note: seniors with diagnosed osteoporosis should still perform this technique. A temporary bruise or soreness is far preferable to suffocation. The chair is a powerful tool, but the next technique approaches the obstruction from an entirely different angle. Number 2. Slam your back forcefully against a wall, corner, or door frame. Many people have never heard of self-administered back blows as a choking rescue technique, but emergency physicians and resuscitation researchers are increasingly recognizing this method as a highly effective complement to the abdominal thrust you just performed. You can do this entirely on your own using any solid wall, corner, or door frame in your home. Position your body so that your upper back, specifically the area between your shoulder blades, is aligned with a wall, corner, or the protruding edge of a sturdy door frame. Then thrust your body backward sharply so the hard edge strikes firmly between your shoulder blades, delivering a strong, focused impact. The European Resuscitation Council, a leading authority on emergency life support protocols, officially recommends back blows as a primary treatment for choking, ranking them alongside, and in some guidelines, even before abdominal thrusts. Clinical research shows that the impact force from back blows produces a different vector of pressure within the chest compared to abdominal thrusts. While abdominal thrusts push compressed air upward from below the obstruction, back blows generate a radiating shock wave through the chest tissue that can shake the food object loose if it has become lodged in the airway walls. A major study published in the British Medical Journal found that alternating between abdominal thrusts and back blows increases the overall success rate of clearing an airway by roughly 30% compared to using either technique alone. To perform this effectively on your own, step slightly forward from the wall or door frame and then drive your body backward explosively, using your legs for added force. Deliver 5 sharp back blows, then immediately switch to 5 strong abdominal thrusts against your chair back. Continue alternating between the two techniques. This combination is extremely effective, but our number 1 tip is the ultimate move that can save the most lives. Number 1. Drop to the floor and perform the ground self-rescue. If you have tried every technique above and the obstruction is still dangerously stuck, this final move is recognized by emergency physicians at the American College of Emergency Physicians as the most important self-rescue skill anyone living alone can learn. Remarkably, it works even for seniors with limited upper body strength or reduced mobility. Here's exactly what to do. Drop to the floor immediately. At this point in the emergency, this step is absolutely essential. Place both of your hands together in a combined fist and position them on the floor just beneath your upper abdomen, above your navel. Start from a kneeling position with your fists between your stomach and the floor. Then let your torso fall forward forcefully so that the impact of your full body weight drives your fists upward into your upper abdominal area with concentrated compressive force. This is essentially a ground-based version of the self-administered abdominal thrust. The reason it is ranked as the #1 technique is that it generates far more intra-abdominal pressure than standing chair back methods, because you are using your entire body weight rather than relying only on your arms and core muscles. Research published in the Annals of Emergency Medicine measured the intra-abdominal pressure generated by every known self-rescue technique and found that this floor-based method produced nearly twice the compression force of standing chair back thrusts. It is effective even for seniors with reduced muscle mass and physical strength. To perform it correctly, begin on your knees with your fists flat on the floor beneath your upper stomach. Drop your torso forward quickly and forcefully so that your fists slam into your abdomen. Each drop should be fast and firm. Reset by pushing back up to the kneeling position and immediately drop again. Repeat this motion rapidly. Multiple compressions in quick succession create a cumulative pumping effect, increasing air pressure behind the obstruction with each impact. Emergency physicians report that patients who practiced this floor technique in advance had much higher survival rates than those relying solely on standing methods. The floor is always available, requires no special equipment, no devices, and no other person. By using the physics of gravity and your full body weight, this is the most powerful and reliable way to save yourself when choking alone. These are your 7 action steps, ranked in the exact order you should perform them. Stop and stay calm. Grab your phone and call for help. Stand and lean forward. Cough with everything you have. Drive into a chair. Slam against a wall. Drop to the floor and save your life. Learning and practicing these steps takes only a few minutes. Not knowing them when it matters could cost you everything. Memorize the order until it becomes second nature, and share this information with everyone you care about. Knowledge that sits unused can't save anyone. Choking emergencies happen fast and without warning. Having a clear plan is the difference between panic and confident survival. If this video could save your life or the life of someone you love, hit the subscribe button now so you never miss another video that can make a real difference. Thank you for watching.